Hi, I'm Dr. Gaurav from Dentists Dental Care. Let's have a look at this all-on-4 case done with digital protocols. Here is the case. This ma'am had a failing upper dentition and she had got a full mouth done previously and which was completely failing, and in the upper, as we can see, the whole processes was moving and the posterior abutments were totally failed, and there were multiple problems like porcelain fracture as well. In the lower also, the processes are failing. So we got a CBCT scan done and it was decided to extract all these teeth and do a full mouth implants. So the old processes were removed. And a impression scan was done using a intraoral scanner, and we got a CBCT scan done. The intraoral scan data and the CBCT data was merged and matched together for implant planning and guide designing. We also did some virtual extractions so as to plan for a guide which will fit after extractions of teeth. The guide was then designed and 3D printed. This is the design of the guide, and then we take this design into a software which prepares the data for 3D printing, and it is called a slicing software. After slicing of data, then we proceed for printing of the guide using a 3D printer. The resin is being poured into the printer and the printer is initiated for printing of surgical guide. Depending on the design and height of the guide, it takes about an hour or two for printing of the guides. After that, this is the final guide that we get after printing. After extractions, the surgical guide is attached to the mouth, and these anchor pins are drilled. And after drilling for anchor pins, we attach the guide to the gums with anchor pins. These are the anchor pins which are attached. Then a tissue punch is used to drill holes for the implant through the mucosa, because we don't want to give any cuts, and we just give pinpoint holes in the mucosa where we will place the implants. That is the reason we don't need any sutures after guided surgery. So once the punches are done, the guide is removed, the punch tissue is removed, and the guide is attached back with the anchor pins. These are the tissue punch that is removed. The guide is attached back with the anchor pins, and now we can proceed for drilling for the implants. This is the drilling for implants through the guide. After drilling, we proceed with the implant placement. That is also done through the guide so that the position of the implant is exactly as per the planning and there is no deviation in the implant placement. The implant is then tightened with a hand torque wrench. This is another implant that is placed. Similarly, all other implants are placed in a similar manner. Multi-unit abutments are attached to the implants, and after attaching scan bodies, a digital impression is made on the day of the surgery itself. Then we send the patient back with the healing abutments placed over the multi-unit abutments. After 2 days, we can see that we have excellent healing of the tissues, and with the impression that we have taken, we have prepared the temporary teeth which will be put in the patient's mouth. So now on the second day itself, we'll give temporary teeth to the patient with which we can eat and use them till the healing of the implants is complete, which takes around 5 to 6 months. And after 5 to 6 months, these teeth will be removed and we will place new permanent ceramic teeth or zirconia teeth as a permanent prosthesis. Thank you so much for seeing, and if you have any questions, feel free to call us or contact us on this number given 75990 15990. Thank you so much.